Welcome to Portsmouth This Week. I'm your temporary host, Bob Poniatowski, sitting in for Doug Smith. And I'm very happy today to welcome a couple of people who are working very, very hard to service our youth in the county. They are Ray Davis, the coordinator of the Portsmouth Prevention Coalition, and next to him, Rebecca Elwell. She's the coordinator in Tiverton, nearby town. That's the town right across the river, isn't it?
That's right.
So I'm going to take a point of view that people out there don't know or don't know enough about what you do, and it's very important what you do. Ray, what is the Prevention Coalition?
In 1987, the Rhode Island legislature introduced the Bramley Act, which created a substance abuse prevention task force, is what they called it back then, in every town in Rhode Island to deal with, it was primarily smoking, was the initial impetus for this being created.
Yeah.
That's continued to be evolved over the years, where every community has a substance abuse prevention coalition, we call them now, which is made up of community volunteers and community members who have a vested interest in substance abuse prevention, and a lot of that's directed primarily at adolescents, and that is in all the towns in the state.
That's the challenge. Rebecca, what is the mission of the coalition? It's the same for all of you, I presume.
It is the same for all of us, and in Newport County we're fortunate because we do work a lot together. We don't necessarily just keep ourselves to our own communities, because the issues are shared and we believe that the solutions are also shared. So the coalitions work together, the coordinators like Ray and I work together along with our other colleagues. The mission really is to focus on the environment that our kids are growing up in. So a lot of our strategies and the ways that we implement programs has to do with changing the environment or the culture within the community. Sometimes that's within a school, and sometimes it's the larger community. So it's not necessarily, approaching just targeting individual students, but more the systems that they live in: schools, communities, their parents.
As Ray mentioned, the history going back to 1987, and you folks working together. My next logical question is, how are the programs funded, and what's changed recently?
They're funded in many different ways in different communities. Primarily, there is a formula that the Department of Behavioral Health, Developmental Disabilities and Hospitals, which is referred to as BUDA, that's the State Department that we all fall under. They have a formula based on population where they allocate funding to each community. In Portsmouth, our allocation, which is all federal money, there is none, no state tax dollars come to any of the prevention coalitions. Portsmouth receives $19,196 a year to do substance abuse prevention. Each town is different based on the population. Portsmouth, we do things a little bit different. Over the years, we've earned the support of the town. The town provides funding in the amount of now it's $22,500.
Wow, that's a good chunk.
That helps a great deal. The school department has funded various programs and funded us as well at times for various things. We do, thanks to Clemens Market, we do receipts, which really makes a difference. We've done all bake sales, and you name it, that's what we do to try and keep afoot.
Yeah.
The other thing is that there are large grants that are available that we have yet to been able to do, but my colleagues in Tiverton, I think Rebecca can talk a little bit about that federal grant, the DFC grant.
So,
yeah, what's your perspective on it, Rebecca?
So the same as Ray, we get federal funds through the state, BHGDH. Tiverton is a little smaller population-wise. We get about 18,000. We have been getting that amount for several years. But we've also had the great fortune of having some successful federal grants come our way. our drug-free community grant, we just finished a 5-year cycle, and that's $125,000 a year, each year for 5 years. And we have just been awarded an additional 5 years. So starting October 1st, we start the 5-year cycle, another $125,000 a year. So as you can see, the disparity between if you have a federal grant of that level and you're trying to be a community like Portsmouth subsisting on about $19,000 plus local money, the disparity is large. So I'm not complaining on behalf of Tiverton. We've been successful.
Will you have to share that money with this guy?
We do not have to, no. It's, but because of the desire to raise the bar across the county, Tiverton and Portsmouth have worked together
Yes.
very
Ray
successfully.
tells me you guys
Just because that's the right thing to do.
Yeah.
So we do have, federal regulations to follow through in terms of where the grant money goes, but in wherever possible, when Portsmouth or Little Compton can be included in Tiverton's activities, they're being funded anyway. When we can add additional communities to that work, it just helps. It just helps everyone. Our students are interacting with one another. They don't live in silos. We don't work in silos. So to be able to do that work together and share in the resources that we have, that's just helped us all be more successful.
That's healthy, isn't it?
I can't stress enough how helpful Tiverton and you, as an individual, have been to Portsmouth, in that we have done a number of things jointly as the communities, as well as with Little Compton, and that has helped raise our ability in Portsmouth to be able to provide better services, to do our job better here. And that's kind of the model that we got involved with
I
this
was
whole
gonna say,
regionalization
you discovered it first.
Right.
Well, this proposal from the state there, agency, is sort of mandating what you should do that you're already doing. Am I wrong?
No, I think you're exactly
Right.
right. It's a mandate from them, but if you want to look from a different perspective, it's almost an endorsement of what we've been doing, and the state is moving into that model. So this regionalization model that's been proposed by BHDDH will take the funding, instead of having 36 contracts with 36 separate municipal coalitions, they've regionalized. So Newport County, not every region is a county, but our region is a county. It's Newport County, all
Oh.
6 communities.
Other regions,
So, for example, Providence
yeah,
is a
it-
county,
it's
is its own region.
yeah, Providence is huge.
I think South County, pretty much, they maintained their county perspective. So,
Pawtucket, Blackstone Valley,
yes,
East Bay.
yeah.
yeah.
Yeah. Well, that sounds like, it sounds like an idea that is going to cause you more complications with funding and, grant writing and so forth and so on, but I think you both have positive feelings that it will succeed well in this county.
I think it will, based on our previous working relationship.
You're going to become a model regional system that you'll have to go all over the state and show everybody else how to do it? That happens, you
We'd
know.
like to.
Yeah.
And I think, I can't stress this strong enough. I think that we in Newport County have the track history and the ability to do our job more efficiently and better than we have ever done, with the state being involved with us, quite frankly, on that side of things.
Yeah, I've been out here a number of years, and I sense that we're different, that there's a certain identity up and down the 7 towns, I guess, that works well in a situation like this. One of you, talk about some of the successful programs you've had, things that were funded or engineered by your groups and that you're proud of, and you think the word ought to get out there and
I think a couple of things that Ray and I specifically have worked on that were successful is bringing additional stakeholders to the table, people who are out there in our communities doing prevention, but they don't even call it prevention. So, for example, Ray and I did a very successful outreach to the local bus drivers. So all of the
wild.
bus drivers for Little Compton, Portsmouth, and Tiverton students,
Yep.
we met with them in their shop as a thank you, and it is an acknowledgement to the really important work that they do. Because the bus drivers, they're the ones that see kids in their own home environment.
Yep.
They're everywhere in the community.
Yep.
Their eyes and ears are open. They're a protective factor for our kids, and they take their work very seriously. So it was as simple as bringing coffee and donuts, saying thank you, expressing our appreciation, and we also gave them some information. One of the hot topics in prevention these days is the use of e-cigarettes and vape devices as a means of smoking, using tobacco without actually smoking it. We wanted to give bus drivers a little bit of information, heads up about that, because they can be used by students very discreetly. We wanted to let them know what to be keeping an eye open for.
Ray and I talked earlier, and I had to be impressed with your outreach. There was a time that the drug problem was a school problem. And clearly, Ray, you got everybody involved, right? You got the police.
I think, substance abuse is a community problem. It is not just the problem of Portsmouth High School or Tiverton High School. It is in every community, in every place in this country. And one of the most effective ways to deal with that and try and prevent some of this has been proven to be through community collaboration. And that means getting the people who can do something about this around a table and listening and working together. And the makeup of our coalition here in Portsmouth is I'm the only person that's paid. I'm paid to work 20 hours a week. My office is in my house. All the equipment for that office is mine personally. But I've got 18 community members from all corners, and that includes a lot of parents. We have officers who are parents, who are the guiding, the body that guides us and helps with these programs, makes all the joint decisions, makes all the financial decisions. It is a true representation of the community, as it is in every coalition.
This is true in Tiverton also?
Absolutely.
Ray mentioned the police, the ministers, the parents, and so, and now the bus drivers, so you're reaching out, you're blanketing.
The school, the town council, as a result of the data that we have produced, which is a scientific study of exactly what are the substance abuse problems, which sometimes are scary, and people sometimes don't like. The truth can be scary. But it's helped in Portsmouth and in many other towns to take the blanket off and say, this is what we're dealing with. And if we don't deal with this, it's going to get worse. And how is the best way we can do this? And the only way we can do it is do it together. And some of that is policy change. Some of it is funding programs, changing some programs. The school department changed their chemical health policy to bring it up to date. They overhauled the health curriculum to include more substance abuse prevention. All those kind of things add to the importance of getting something done about prevention.
I think that what strikes me as so effective is that everything is coordinated now, and in the past, my experience, and that's kind of an old experience, is that there were all these segments. The church was doing a little something, and the schools were doing something, and the parents group would form and all that, and the ministers would notice things. But this coalition now sort of brings it all together, and so the focus is there.
I think one of the things that we did in Tiverton, Little Compton, and Portsmouth is we did an outreach to all the faith communities because
Oh, sure.
because they have that's a front line too. That's
Oh, absolutely.
a strength factor many times, and we were able to provide them with information that they could give their parishioners and congregation about if they had issues, where to go, and we've developed a working relationship with that group.
Prevention has come a long way since
Yes.
since we started being funded
Yeah.
by the state of Rhode Island in 1987. And back then, as a state, we were really on the cutting edge. The fact that they had identified task forces within the communities to do this work, that was cutting edge nationally. And Rhode Island got a lot of kudos for that nationally. Over the year, unfortunately, the model didn't really change, and funding was cut. But simultaneously, prevention as a science and as a profession has changed and developed. So it's no longer just doing a good thing or having good intentions,
I sense
but
that.
there's a science behind it and there are best practices behind it. Part of the best practices is having that community sector representation on the coalition.
Yeah.
So we have 12 identified sectors, of which law enforcement, school, business, parents,
Yep.
students,
Police, I
you know,
mentioned
all
police,
of them.
absolutely.
All of those sectors are represented because they have a different role in the community that they can actually do a different aspect of the work.
That's right. And I was fascinated with my discussion with Ray this morning in the way that you gather data. Years ago, I'm sick of talking about years ago. How do you identify the problem and the extent of the problem? Talk about your data gathering models.
Okay.
We use a model where, first of all, there was a survey done with students, and it is totally anonymous. Totally anonymous. For 7th, 8th, 9th, 10th, 11th, and 12th graders. And we just completed the 3rd year that we've done that. The survey is on tobacco, alcohol, marijuana, and prescription drugs. We ask perception of risk and harm. We ask perception of use. One of the things that we ask all the time is, how many of your fellow students do you think drink alcohol? And the kids will say, oh, probably 98%, 99%, when in actuality it is nowhere near that.
Yeah.
The same that holds with marijuana. Oh, I think everybody smokes marijuana, or almost everybody. Again, that's not the case. Are those numbers too high? Yes, but it's nowhere near what the perception is.
I'm reminded of the typical teenage response when you're talking to them is, everybody's doing it, and that kind of data you don't need.
And that's problematic because if
Right.
you are a young person and you think, well, everyone is
doing it.
what is going to prohibit me from doing it?
Oh, sure.
So that is one of the reasons why we really address that we assess that question and we address the gap between the perception that kids have and the reality. Reality of use is that it's around a third to a half. It is surely not everyone participating. So we want to give them the clarity to understand that what they may be perceiving may not actually be the reality. And there's a lot of work that can be done in that area.
Not only the kids, but the community.
Well, true. And
how many parents, non-public school parents, oh yeah, that school is full, everybody's, in a daze. And so it's important that they get the straight poop.
In addition to that survey, which is important, we also do focus groups with students, which is totally anonymous, and that focus group is myself and our evaluator. There was no one else in that room with us. We also do it with parents as well. Key informant interviews, like with the chief of police, the school resource officer, and by the way, This is the first year that we've had, last year was the first year we've had a school resource officer in the Portsmouth schools, which is the largest school population in Newport County. That has been a huge help to us. And, you know, hats off to Chief Lee and the police department
glad to hear that.
for doing that. And that position was funded through the town of Portsmouth, the police department, and the coalition put some money towards that. But that's something that came as a result of us doing these studies.
I read the paper every day, and I'm sort of struck by the changing police model. It gets to be more community outreach and being visible, being available. You know, being visible out there so that people don't see you as sort of an enforcer, but as somebody who's interested in your welfare, and that you would bring them on board. It sounds like you're doing the same thing.
I think there's been a great example of how important that position is. I think it just happened in one of the other schools in Rhode Island, where there was an incident where the students went to the school or to the school resource officer and told them about a situation before it happens. That is a huge factor in preventing things, and that's happened in Portsmouth. It's happened in Tiverton. Those are some things that we helped educate the community on the need for that, and you know, we're fortunate that we live in a community that has supported that.
Yeah, support is just so. I wrote down here, why should we care? And I did that because I'm thinking of the folks watching the program, and you're talking about all this material and costs and people. Why? So what? What's our stake in it? The public.
Right. So I think in terms of preventing substance abuse and substance abuse disorders, there's a cost to addiction. When an individual is addicted, is having drug and alcohol problems, there are financial costs to the community. There are public health and safety costs to the community. So if your concern is not necessarily for the individual or for a young person, or if that's not where someone's focus of attention is, there's a drain on our law enforcement. Crimes are connected to substance use, and not just the drug dealing, but theft, property crime based on individuals needing the money to supply a habit, etc. So there's a cost.
You pass.
Incarceration. We have a national issue with individuals incarcerated for drug crimes. There's a cost, a societal cost. There's a societal cost when students are struggling academically because of substance use issues. We're paying to have our students educated. We want them to come out the end of that process with an education. And so there's a cost there.
It's like the old saying, pay me now or pay me later.
Right, sure.
And I don't know about you, but I don't think that there's too many things that are more valuable than our youth, because they are the future of Portsmouth and they are our future. And I don't want to have a bus driver who's high driving me around, or a pilot who's high flying me somewhere. We as a country need our people to be their best and the brightest.
Oh, there's daily in the paper a bus driver, a train operator, somebody who, is a little woozy.
And I want to say again that the majority of kids, young people, do not use these substances. And my hat is off to those kids who have the guts to make a decent decision saying, you know what, I don't want it. I don't want to wake up and go to school and feel not at my best to be able to take this test or to play on this team. And what the message that some students give to their other students is probably more important than anything that's coming out of my mouth right now.
You mentioned the Patriots Committee thing.
Committee
I like that.
in Portsmouth, and Tiger Pride in Tiverton. And if we get a chance, I'd like to say something about Portsmouth Committee, if I could.
Sure.
There's a big fundraiser.
We got about 3.5 minutes,
All right.
so go.
There's a pasta dinner on October 15th at St. Barnabas Hall from 6 to 8 o'clock. It's pasta, there'll be games and prizes, a silent auction. All that money is for the substance abuse prevention education in the Portsmouth schools. You can get tickets through the assistant principal, Colleen Larson, at the high school. You can get in touch with me. We can give you those tickets. But all that goes to those kids. And those are the kids in Portsmouth that say, you know what, I'm making a decision not to get involved with this, as an example to other students. And Tiverton does a similar thing, too.
The role models, and you know, the thing is, I'm thinking about coming here and talking to you folks is the adolescent, and what a handful that is. And so when you can get these models and these sort of students who are committed and are visible, that has more effect than Lecturette 47 and the little booklet and all the other things.
Well, we know about peer pressure,
Yes.
doing the negative things, so this is a
yeah,
little
this
twist
is-
on that, to be the peer
That's
pressure, to
unfair.
do the right thing.
You're using their own tools against
Exactly.
them. In a couple of minutes, I know, Ray, we wanted to mention the support in the community. You mentioned some of the politicians and school boards and other people in the community that are supporting you. Do you want to give any of those people a stroke?
I want to thank the legislators, both Republican and Democrat. This has nothing to do with politics. This has to do with our kids, who in this county and in Portsmouth and in Tiverton have stood up and said, you know what, we want to. They've asked questions, they've gotten involved, they've advocated for us at the State House, and have made that a platform in their campaigns. And we're not getting, without the support of the state tax dollars for such a serious problem, it's impossible to move forward. And we need that support because we have a serious substance abuse problem. We're number 3 in the nation now.
Yeah, that's startling. I just find it so outstandingly difficult that the state doesn't get involved in supporting this. Right now, I guess the money comes out of Washington. It's a block, and it's sort of passed through, and you get it. And now it's a regional thing, but the state is just too busy building highways, a few other things, and bridges that they sort of forgetting this. Well, we got 1 minute. Anything you want to tagline on or leave a soundbite before we go?
Again, you know, I can't. Working together, and it sounds Pollyannish, and I don't mean it that way at all. This is a good idea for Newport County, for all of us to work together to be able to create some better results, because we've demonstrated, I think, how we can do that with our 3 communities. We can do it with all of our communities here, because our colleagues that work in the other towns are very good at this as well.
That's great. Well, Ray Davis from Portsmouth and Rebecca Elwell from Tiverton, I want to thank you very much for coming on today and do it again as the new year starts and you get new money and new ideas and new initiatives. Come back and tell us about it.
Thank you.
Thanks again. That's all we have for Portsmouth this week, and we'll see you next time. Take care.
Portsmouth This Week is a regular program on Newport County Television that brings you important information on town organizations and policies and discussions with town leaders and other important decision makers. A listing of program times is available on Cox Cable Channel 17 or at the program listing website. A listing of all programs with YouTube links is also available at the Portsmouth Town website.